Just to reinforce the issue of testing, it is very, very important that we have that capability in order for us to be able to understand the extent of the disease in the country. But I really concur, this is a challenge, but have just come out of this National Emergency Response Committee meeting. We now have about 5,000, and by, I think, this week, beginning Monday, we will be able to receive 24,000 more tests so that we are able to increase our capability for testing. But that still remains a challenge because it's not enough. But it's not enough in the US, it's not enough everywhere because these are commodities highly in demand all over the world because this is a pandemic that is happening everywhere. The issue of quarantine, I would like to speak in two ways about it. Number one, the counties are very much anxious about the fact that people who are collected from curfew are being taken to quarantine because people who drink or are walking on the street during curfew are lawbreakers. Quarantine is a public health strategy, and therefore it is very important to separate a public health strategy which is supposed to be embraced, supposed to be supported, supposed to be looked at it positively, with lawbreakers who walk at night and break the curfew law or rule. Therefore, this discussion is ongoing, and we have brought the concerns of the counties, and it is going to be dealt with very, very soon, such that a quarantine is if you are in contact with a positive case, then you are quarantined for that reason. You are not a lawbreaker. You are not in any way broken any law, and there is nothing stigmatized or there's nothing negative about it. It's a public health strategy. But if you are walking at night, you are a lawbreaker and you should be dealt with. Maybe the place to go is the quarantine within prisons, not quarantine within public health facilities. That debate is ongoing. We have raised it, and we will be able to come to a clear conclusion about that because it's a serious issue that has to be separated. But the issue of people not going to health facilities because of cost of quarantine, that I think is also a possibility, but more importantly is for the fear of the disease. Nobody wants to catch coronavirus, and coronavirus, you know, is more likely to be infecting in areas where there is more visits, more touching, and more crowding, like in health facilities. And that's why we closed hotels, we closed all places, but we cannot close hospitals. So that stigma is still there of getting infection at a hospital. But we are trying to create a policy, a protocol, where there is social distancing even in clinics, and also there is fumigation of health facilities to minimize but the final or the long-term solution is to have COVID facilities away from the normal hospitals so that people can have the confidence to go and be attended for clinics, for malaria, for TB, for HIV, and other health conditions. Thank you very much.